Hello, everyone. Thank you for joining us today. We're going to be having a presentation on music therapy in older adults. And with us today, we have Jennifer Miller and Mica Trupiano. They are both board-certified music therapists with ADEC. Jennifer has worked for 2.5 years with individuals with intellectual disabilities. She received her music therapy degree from Alverno College in Milwaukee, Wisconsin, and completed her 6-month music therapy internship at Milwaukee Mental Health Complex. Mica is also a board-certified music therapist, and she just celebrated 4 years of working with individuals with intellectual and developmental disabilities. Mica received her music therapy degree from Western Michigan University and completed her 6-month internship at Lighthouse Neurological Rehabilitation Center in Caro, Michigan. Jennifer and Mica, you can go ahead and get started when you're ready.
Okay, thank you for that wonderful introduction. My name is Jennifer, and I'm going to be starting off here. So hello, everybody. Welcome to today's webinar, Music and the Older Adult. Thank you for taking time out and being with us today. I know that it's a crazy time right now with getting together and everything that we've had to deal with the last few weeks. But Mica and I appreciate the opportunity of speaking with you today about our experiences in the music therapy field. And today we're going to be looking at the following. We're going to be looking at what is music therapy, what are some common challenges for older adults, how can music therapy benefit the older population, and how can case managers, service providers, and families use this information. And so now we're going to move on to the definition of music therapy. I'm going to pass it on to Mica.
Hello, everybody. My name is Mica, and here is the definition, which you can find on the American Music Therapy Association website. They say music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. A lot of big words there, but some things to highlight is that it's music interventions, not necessarily just singing or playing for the sake of singing or playing. There's a purpose behind it. The goals guide the interventions that are used. The relationship is also a big part of therapy, and the fact that it's a credentialed professional who has completed that approved music therapy program is also part of what makes music therapy music therapy.
Okay, so now we're going to move on to what is music therapy, a brief history. So for many of you, you may or may not have heard of music therapy, but music therapy has been around for thousands and thousands of years, even if it has not been known by that exact name. So it's actually just recently where music therapy has gotten its name, starting in World War II. So in World War II, music was integrated into the rehabilitation for injured soldiers. Military encouraged the use of music to lift morale among the soldiers. Then musicians began to implement diversionary and other music activities for those who were injured. And then due to the success, music applications were spread to civilian hospitals, and music associations supplied instruments and leadership to support those hospital programs. So as this demand grew for therapeutic music services, so did the demand for the training. Michigan State University implemented the first degree program in 1944. So that's pretty recent if you think about it. And that was followed by 4 others over the next 2 years. The University of Kansas, the Chicago Musical College, the College of the Pacific, which was located in California, and Alverno College, which is where I graduated from, actually. So the greater need to provide communication, organization, and leadership to many people engaged in the uses of music in hospitals, we needed to rise up and meet these needs and these more demands. So to meet the needs, the National Association for Music Therapy, or NAMT, was established in 1950. So again, quite recently, if you think about it. And the American Association for Music Therapy, or AAMT, was developed in 1971. In 1998, both organizations united to become the association, the American Music Therapy Association, or AMTA, which is what it's known for today.
Music therapy research continues to grow as technology advances, allowing for more measurable outcomes. This includes brain scans, being able to see what the brain is doing while people are actively making music, and other medical advances that are able to measure things such as pulse and blood oxygen levels as people are listening to and exposed to and participating in music. So what is music therapy? We've talked about this a little bit, but we're going to kind of expand on this. Music therapy is individualized. It's very much goal-oriented for each individual. There are specific evaluations that are done to make a goal that is only for each individual. It's measurable and it's data-driven, based on research that has been done. It's active participation in music interventions. It's not simply a passive thing. Getting the clients involved in the process of music making is part of what music therapy is. And it's under the supervision of a board-certified music therapist. What do music therapists do? I'm going to kind of walk you through the process of from beginning to end of therapy. I guess at the beginning, even before music therapists meet an individual, we need a referral, which can come from a case manager. A person can self-refer for music therapy. A family may hear of music therapy and request it for a family member. So once we get that referral, we do an assessment to see if a person is appropriate for music therapy. And once we determine that they are someone who responds to music and has goals that we could work on, we're assessing their strengths and their areas of need. Based on that information that we gather in the assessment, we design and implement individualized music therapy treatment. That could look like increasing communication for someone who is maybe having more difficulty communicating. So how are we going to do that? We could encourage vocalizations through singing. And as we do this, as we implement this treatment, we're constantly evaluating progress towards whatever goals that we have for each individual. As we are doing this, implementing treatment, we're constantly also communicating with caregivers, family, and the team If they are in a facility and we give that music therapy in the facility, the staff should be involved as much as appropriate. Families should be kept up to date on what is going on with that, so that we can make sure they're having the greatest benefit for that music therapy. And then determining when music therapy services have reached the maximum benefit for the individual. It could be that the therapist is not able to serve the client anymore. They've reached their potential as far as that particular therapist is concerned. It could be that maybe they lose interest. A variety of reasons. Other needs may come up that are more pressing, and music therapy may no longer be beneficial for them. So determining when music therapy services have reached the maximum benefit, and then terminating services in an appropriate way. Some common challenges for older adults.
Interject just a second. Someone is asking that someone said the sound's going in and out. I don't, no one else has said anything, so I just want to do a quick check. If anyone, if they're having trouble hearing, could you make a comment so I know?
Okay.
Sorry.
We will try to be a little more clear and a little more articulate. Articulate well.
And other people are saying they can hear just fine, so maybe it's just that person.
Okay.
Okay. Carry on. Thank you.
So common challenges for the older adult. I think probably most of this is information that we're kind of aware of just in society. Memory is something that is a challenge for older adults. Forgetting where your keys are is the cliche, but it can become even more distressing than that, not being able to remember, especially with a dementia diagnosis, not remembering loved ones. With that goes reality orientation, understanding what is going on around you. Can you find your way back home if you are outside in your front yard? Another thing is mental health. With age comes a lot of loss, and isolation and depression. These are some risk factors for growing older. So socialization is another issue.
So so socialization is another common challenge for a lot of people. So does the person turn inward and become despondent? This is kind of connected, I think, to the mental health challenge, where does the person isolate themselves? They might be more prone to depression and loneliness and may not socialize with their family or with friends or peers. And then again, you have other adults who may interact with socialization. So it's really a personalized thing depending on the individual themselves on how they react. Another common challenge is communication. And this is a big one that we see across the board. So a deteriorate in language function. Some common things that might come up in terms of communication would be aphasia. You might have heard that term before. Aphasia is the difficulty in pronouncing names of individuals and objects, okay? Another sign is echolalia, which is the echoing of what that person hears. I hear that a lot in my practice with my individuals. Another one, which is less common, but it's still around, is polylalia, which is repeating sounds or words over and over. And again, I see this a lot in terms of the individuals that I work with during the day as well. So communication is a big area that music therapists work on. The last main challenge is fine and gross motor skills, okay? So fine motor skills would be intricate. So using fingers, moving your toes. Gross motor skills are the bigger movements, using your arms, walking, using your legs. And we tend to see a decrease as just common aging occurs. One of the other things that we see is a term called apraxia, and you may again have heard this term before. Apraxia is the impaired ability to execute motor activities despite intact motor abilities, sensory function, and comprehension of required to the task. So again, the brain is working, but their body is just not following what is required of them at that time. So again, these are just very common challenges across the board for the older adult, and some of the main things that we see in our music therapy profession.
So some of the benefits of music therapy, we're just going to talk for a little bit about what music is. Music is flexible and it's also predictable. And these two may seem like a contradiction, but they actually work together pretty well. You can have a well-known song, Twinkle Twinkle Little Star, but there are so many things within that predictable melody and those predictable lyrics that you can change and flex. You can change the tempo, you can change the articulation, whether you play or sing smoothly or more markedly. These different things can help interact and get the attention of the person that you are that you're interacting with through music. Being able to predict what's coming next is helpful. But sometimes if you're too familiar with what is coming next, maybe you need to be flexible. The music therapist would use the flexibility of music in order to change something to get the attention, to bring the attention back to the music.
Another benefit of music therapy is that music can evoke associations. And I think we've all come across this, where you turn on the radio and you hear maybe one of your favorite songs, right? And there's certain associations that are brought to you with that song. So it might be a time, a specific place, or maybe even a person. And these associations may evoke certain emotions, or like a visual information, or other sensory information, such as like a specific flavor, an odor, texture, a temperature, or a comfort, or even a discomfort that's associated with a specific song. If you even think about back to your childhood or music when you were a teenager, and you hear those songs today, I know for me, you know, it brings up that time in my life where I really enjoyed that music, and I may not have heard the song in many years, but I remember all the lyrics, surprisingly. So again, music can evoke specific associations. It can also provide for musical expression. So usually when in older adults or anybody, any certain population, you know, people may have some difficulties expressing themselves emotionally. So music can help provide for that in several ways. So how can you express yourself emotionally? Well, through singing, like Mica had talked about, vocalizing, having discussions about a particular song or a particular emotion. You can also express yourself emotionally by playing an instrument. Maybe it's an instrument that you had played in grade school. Maybe it's a new instrument, such as like a drum, and you're feeling, let's say, angry that day. How are you going to express that on the drum, right? Physical movement is another way that we can express ourselves emotionally. Is the person not moving? Are they moving a little bit? Are they tapping their feet? Are they clapping? Are they chair dancing? You know, are they really getting into it? You can express yourself emotionally through that physical movement. And finally, through facial expressions. Is the person smiling? Are they laughing? Are they frowning? That tells you a lot about a person's emotional state. Just by looking at those facial expressions that the person is making.
That all kind of ties into what is the music therapist doing during all of this. The music therapist is providing those musical experiences, often live, sometimes recorded, but as they are providing them, they are assessing and evaluating how is the person responding. How does this address their goals? Another way that we can do an emotional expression. I was just reading an article today that I found in the Music Therapy Perspectives Journal about music therapy or songwriting and dementia. So group therapeutic songwriting is a way to use music in a very creative way, where you are creating the music. You are deciding what the message is for that song, and what music do you choose to express the emotions that you want to express in that song. Music therapy, or music, also facilitates social interactions. I remember one of the music therapy conferences that I went to. They're always interesting events to go to, because it's a bunch of professionals who are also very creative and can be very loud, can be very exuberant. We, in our opening session, the speaker or guest speaker there had us all up and singing a song that he taught us that was very simple, that facilitated social interactions. I think this was, I'm forgetting exactly, but this was the same song that he used in a leadership type of conference decision-making situation for a board of something. I'm forgetting what. But to show the power of music and how well it facilitates social interactions, he had us up and shaking hands with everybody and finding new people every verse to shake hands with or to high five, depending on what the song told us to do. Music also provides physical and emotional stimulation. I enjoy contra dancing, partly because the live music is something that I can't quite sit still to. Even if I'm not dancing during any particular dance, I am tapping my toes and moving my body, just because of the rhythm and the emotional stimulation for me for that particular kind of music. Everybody responds to their own kind of music. So a music therapist can find the music for an individual to provide that physical and emotional stimulation.
Another benefit of music therapy provides opportunities for communication. And this is a big one that we see every day, that we're working with someone, and not just in our profession, but also outside of the profession as well. This is where music is so great, where the person can be verbal or nonverbal, and music can still be beneficial. So for communication, music provides verbal opportunities to express themselves in the forms of discussion, in the form of singing a song, making decisions, perhaps writing a song, given a songwriting opportunity. So maybe you're in a group setting, talking about a song. I know during my internship, we did a lot of song discussions. I was on the psychiatric unit, and individuals were able to pick one of their favorite songs from a collection, and after the song was played, we all discussed it. So again, in the very nature of music, it provides for communication. And also, even if somebody is nonverbal, music can provide the same opportunity by playing an instrument, you know, playing a drum, playing a tambourine, playing a cymbal, you know, and even moving to music is a form of communication as well. Body language, how the person is moving their body, can communicate to you how they might be feeling. Again, this kind of goes back to emotions and expression, how that person might be feeling. Music can also provide a diversion. Usually a diversion is something that is uncomfortable or a discomfort. And so different music activities can be used. So singing, playing an instrument, dancing, listening to a song, going to those concerts, can provide a diversion, even if it's just for a short time. So I work with a client who suffers from depression, and just having that opportunity to listen to her favorite music provides that diversion that she's looking for. So for that moment, she's wrapped up into her favorite songs, and it kind of alleviates that depression for a while. So those are some ways that music can benefit individuals.
So now we have kind of almost a way of tying it all together. What does this actually look like? Singing, music and movement, active music making, drumming, using the ISIL principle, name that tune, music memory games, song discussion, life review. I don't think we put songwriting here, but that's another thing that music therapists could do, depending on their training and their level of comfort and creativity in that area. So we're just going to go through and share some stories from our own experiences with these.
So for singing, singing is a huge part of what we do, and especially with the older adults. When during my music therapy internship, and even now with some clients, you know, they might not remember their name or the names of other people, their peers or family members, but man, you play them a song from their young adult years, and they can sing the entire song, and it's just amazing to see. So again, singing in a group setting or just individual setting as well, I've seen the benefit, you know, of that intervention.
We actually both, first I and then Jennifer had the opportunity of working with one individual who really loved Elvis, and he couldn't necessarily even articulate all of the words, but singing for him was very therapeutic, a way for him to express himself, and I think he found a lot of his identity in his being an Elvis fan.
Yes, and he would always smile when he was when he was listening and singing to the songs, and he would dance like Elvis, you know, moving his hips side to side, and we'd even call him Elvis, and he would just laugh. He would get such a kick out of that. So he was an individual who happened to have dementia, and so, you know, again, you know, he didn't know my name, you know, didn't know his peers' names and what have you. But yeah, he was able to say, hey, I want to let's listen to this Elvis song, you know, maybe one that I've never heard about before. And he was able to remember those titles from his young adult years. So it was really great to see.
I think in the singing, in the music, in the moment, none of the other difficulties that he had really mattered. It was all about the music. Music and movement is another thing that we can do that might look like having a parachute or maybe some sort of a stretchy band, following a music therapist who is playing arpeggios on the piano, going up when the music goes up, going down when the music goes down, following that a little bit. It could also mean dancing or chair dancing, getting those gross motor movements in.
Yeah, and I think that's the movement part is important too, in terms of the music. So not only can you know, listen and sing to a song, but movement I think is inherent in the experience itself. You know, you might have a goal for the person to maintain optimum health, and for health, especially now, we've got to get that movement in, right? I mean, we can't, you know, go to certain places or do what we were able to do before. So it's so important to move, and music, you know, has that ability, you know, you just tap in your feet, you know, tapping, you know, your whole body moves to that. And I think that's really an inherent thing in music, and getting that movement in. So you may have, you know, I may have an individual who needs to get that movement. So, you know, walking to music, using scarves, moving the arms, again, like Mica said, getting that fine and gross motor control in there that we had talked about earlier as a goal, would be kind of under that umbrella there with music and movement.
And many of the movements that we do are rhythmic. Music is also rhythmic. So if an individual has suffered a fall or has, for some other reason, lost the ability to walk with confidence, music, using the rhythm of music, can help that become trained again for them. Music therapists are able to work with individuals in that area too.
Active music making is a big one. I think a lot of people still have a misconception about what music therapy is. When I'm asked what I do, and I say I'm a music therapist, they're like, oh, you just listen to music. No, that's not all we do. Music therapy participation is active music making. So all the senses are involved. So not only are you listening to music, you're making music, you're singing, you're playing an instrument, you're moving, you're dancing. It's all around activity. So it's not just sitting there and listening. And so I think there's still a little bit of a misconception about that part of what music therapy is.
Even sometimes when you are sitting and listening, that can be part of music therapy, but there is, even in the sitting and listening, there is an active, it's an active listening experience.
Right.
It's still goal directed.
Definitely.
Yeah. With the same individual that we were talking about earlier who loved Elvis, as I was working with him, his communication was declining, and I was struggling to figure out what goals I could work on with him. communication would be great, but I wasn't sure how to make that happen. I sat down at the piano with him and just said, "Follow me." And I played, I was on his left, so I was had the bass notes, more of the harmony, if you know a piano layout. So I was doing different ways of playing piano. I was playing chords, and then I was playing individual notes, and I was playing quickly, and I was playing slowly. I was playing loudly and quietly, and he followed me. I was quite impressed. He couldn't communicate clearly, but he was with me. We were very much in sync in that active music making experience, which is pretty cool.
Definitely. Yeah. Drumming is another intervention I use a lot actually in my practice. Drumming is rhythmic, it's reality orientation, it's structured, which I think makes it so beneficial, and it's accessible, with the different drums that we have. And establishing a rhythm and bringing that person back to, again, reality orientation.
And most of when music therapists drum, mostly it's just hand drumming, like an African drum type of drum, not necessarily a drum set.
Right. Right. Drum set might be a little too much, yes.
I personally have very little experience with drum sets, but yeah, I feel like that might be more intimidating. But a hand drum, all you need is a hand and a drum, and technically you can play a drum, even if you may need some assistance. Very, very accessible.
Yes, very accessible. Exactly. Yeah.
Drums are used for communication. So I have another individual who's not an older adult, but we have giving her opportunities to communicate through drumming. I would listen to what she did on the drum, and I would imitate what she did. She has still to really use her voice very purposefully to communicate, but seeing me respond to what she was doing on the drum, she was heard and she was responded to. And the first time that I did that, it seemed like it was kind of an exciting thing for her to have that response.
Mm-hmm. And for me, using the drum for individuals who have communication difficulties, articulation, speaking, they might speak too quickly. And so drumming is a way where we tap out the syllables. So I use the drum because it's just inherent in the rhythm of speaking, right? And when we're speaking, when we're talking, there's a rhythm to it. So just kind of, tapping out syllables, working with somebody who has communication goals and objectives is very, very helpful. And you do see a big, at least for me, I see a huge difference in utilizing the drum.
I definitely have at least one or two individuals that I'm working with now who have goals to increase their clarity of speech, and part of that is slowing down instead of garbling everything all together.
Yes.
What did you just play? Let us slow it down.
Yes. Moving on to the ISO principle. Some of you may have heard this concept before, some of you may have not. But as music therapy students, it was one of the first things we learned in our classes, the ISO principle, meeting the individual where they are at. If you have an individual who's bouncing off the walls, running across the room, you're not just going to go in there and play a soft, slow song. That's not going to do anything. So you want to meet the person where they're at and then bring them down to a level, okay? I use this a lot, well, with everybody, but in particular with some of my younger people who are bouncing out the walls and running around the room. I meet them where they're at. So if they're running, run, you know, I use a faster speed, and then I manipulate that. I manipulate the timing. I manipulate that to bring them down to where they need to be for therapy. So that's what music is so great. You can manipulate it to fit that person's needs, I think.
And it works the other way too.
Mm-hmm.
ISO just means same. So whatever the same is where they are. If they're running around the room, then meet them there. But if they are moving very slowly, you can meet them there too. And this might be even more applicable for older adults who are more sedentary. I had one client that I worked with who just getting her to stand up would be difficult. Getting her to move across the room, to come and sit in the chair to start the session, she was very slow. So using music to meet her where she's at. She's not going to respond to something that's too quick. But music being flexible and predictable, we can start it slow and speed it up according to how she responds.
Definitely. Yeah, definitely. So these last three that we have listed would be more for somebody who's verbal and who does have the ability, the more of the higher functioning cognitive ability for name that tune or a music memory game. So when I was doing one of my clinicals in geriatrics, they were more of the higher functioning, and we did do a name that tune kind of game where we would play a song and then they were able to say, oh, that's, you know, whatever the tune may have been. So again, you know, getting that social interaction in there, getting in participation, socialization, you know, again, going to that part of the brain where you're tapping into the cognitive, into their memory, you know, keeping that area stimulated was important.
Song discussion is one of the things that I enjoy doing with my clients. Lyric analysis is what it's called in music therapy literature. And it is taking a song and saying, what does this mean for you? How can you relate to this particular song? You could use a song from their younger years and discuss the memories that are associated with it. Or you could use a song that maybe they'd never heard before that tells a story and then communicate how that makes you feel. Being able to externalize their thoughts and feelings on something that they may not have another opportunity to really talk about. The music can be the vehicle for that.
Yeah, and again, that wouldn't work in every case, but it's definitely beneficial, and you see a lot of great things come out of discussions. But again, you know, it really depends on the individual, or if you're working in a group session, it really depends on the group. So the music therapist needs to know exactly, you know, the functioning of everybody in the group or the functioning of that individual to use that particular activity in that case.
You don't want to cause frustration with someone who is not able to really discuss, not able to communicate clearly verbally, or not able to cognitively answer the questions that you may ask in a song discussion. So that's where the training comes in, of knowing how to apply these different interventions. Life review, I think, is something that is often used in hospice settings, being able to create perhaps an album of the songs that kind of tell the story of your life, or create songs, original songs that also may tell your life story. Maybe writing a few songs for family members that they can then have on a CD. It's not something that I have any particular experience with, but this is another intervention that music therapists can do. So we've shared a lot. How can you use this knowledge? Case managers, you can share this information with families. Now that you know a little bit more about what music therapy is, if a family is interested in music, or if there's an individual who always has earbuds in and is always listening to music, or enjoys singing in the middle of a meeting, or whatever the case may be, you can help to determine if music therapy is appropriate for that individual. Just because someone enjoys listening to music doesn't necessarily mean that music therapy is appropriate for them. They need to be able and willing to engage in an active music environment. Families and caregivers, recognizing the unique benefits of music therapy and incorporating some of these some appropriate music activities into the living environment. It's not technically music therapy if there is no music therapist, but music is accessible to anyone and everyone. So knowing more about how to use music to enhance the life of the person that you are caring for. And service providers, other people who may be working with an individual, can also recognize the unique benefits of music therapy, potentially recommend music therapy to families if it's appropriate, and collaborate with music therapists for a more holistic treatment approach. We, as music therapists, we don't necessarily like to just be the music person that comes in for an hour once a week, or the person you go visit for 45 minutes and then has no connection with the rest of that individual's life. The point of music therapy is to be able to see benefits that are transferring over into the rest of their life.
And I think holistic is the important word in this sentence, where you want to treat the whole person and not just little parts of the person. And that's why I think it's important that music therapists work with providers, work with the team, so that we also can learn to how better to assist the individual, how to maximum the benefit of music therapy services. So a holistic approach, I think, is very important for everybody.
I definitely enjoy being a part of a team for an individual.
Yes.
So this is just copied and pasted from our first objective slide. What is music therapy? Hopefully you have answers to these questions a little bit more than you did before. What is music therapy? What are some common challenges for older adults? How can music therapy benefit the older population? And how can case managers, service providers, and families put this information into use?
So hopefully today, our goal was to answer those questions for you and to provide that information. So hopefully it all made sense, and we got that across to you.
Our conclusion here is just going over a couple of the things that make music therapy unique. Music therapy is very much success oriented. As we said about playing a drum, all you need is a hand and a drum, and you're able to play a drum, making it as accessible as possible to be a part of a music experience. Music is a universal medium as well.
Right, right. Which is I think what makes music therapy so special, is that it's universal, that every culture has music. And I think that's really what makes music therapy so unique, you know, in its ownness.
The medium that we use.
Yes, yes. Music therapy also matters because it's adaptable to each individual. So over the course of this webinar, we've talked about how music can be used with verbal individuals and nonverbal. So music is easily adapted to fit the individual's needs. And the important thing, just like in our point, it's successful. You can't do this wrong. You can't play the drum wrong. So it being adaptable and successful, I think, is two of the main ways that music therapy is so unique and special.
Along with accessible, it's maybe different meaning of the word, but it's also pretty cost effective. If you, depending on the goals and depending on different treatment options that there are available, pain reduction can be addressed through music therapy, depending on the therapist, depending on the setting, but that is a goal that the music therapists have, and that's more cost effective, fewer side effects than a pain medication. Music therapy also can reach the whole person, physically, emotionally, socially, cognitively. We could probably add a lot of other adverbs there.
Yes, we could. This is true. But I think over the presentation, we have talked about all those areas of how music can reach the person physically, emotionally, socially, and cognitively. And I think that, again, I think that's what makes music therapy unique and special in its own right.
So our last slide here is some references or further resources. We have the American Music Therapy Association website, and which has a lot of different fact sheets of music and different populations. The Certification Board for Music Therapists website has, I believe, a directory of music therapists. You can search by population and by region, I think, by location of where the music therapists are. Also, on these two websites, you can find the documents that guide our clinical practice too. We also have two books listed here, The Therapeutic Uses of Music with Older Adults, and An Introduction to Music Therapy Theory and Practice, which are two of our main books that we use to give us guide this webinar today too. So with that, that's all that we have, unless there are questions.
I do have at least one question here.
Okay.
Somebody asks, many times the goal that I see for people is to express feelings appropriately. How is this measured for someone who is nonverbal or has memory loss?
Express feelings appropriately. That seems like a good goal. And so you take that goal and you break it down into an objective, which would be something very specific, measurable, attainable, relevant, time-oriented. Those, I don't know if you have heard of the SMART acronym for how to make an objective or a goal. So something specific. So if you are that would be taking the positive expression of emotions. Perhaps they are not expressing emotions positively. Perhaps they are either expressing anxious behaviors or acting out in a harmful way. So the objective then could be that they will decrease the amount of time that they are, or the amount of whatever the negative expression of that feeling would be, using music in some, and it all depends on the client. It all depends on the individual in the setting too. So I don't know if that, I feel like that's a partial answer to the question. I don't know if you have anything else to add.
What was that last part of the question?
It was asking how you would measure an appropriate feeling expression if someone was nonverbal or had memory loss.
So how you would measure the response.
So you would choose what the response would be. Some sort of behavior, something you can see and observe. So whether that would be using a word to express a feeling and measuring how often they do that, or trying to think other different ways that they would do that. The main thing is that it has to be something that you can observe in order to measure it. It has to be something that you can count, or it's something specific enough that you know that this is the one specific thing that I'm taking data on.
Yeah, and I think that goes, I think that kind of ties into the individual specifically and the behaviors exhibited by that individual in session, and for the music therapist to determine how they want to address that, especially if they're nonverbal, or if they have if their memory is impaired. It's going to be a little bit more difficult to successfully measure that. It can be done. I think it depends on the situation.
Yeah, you could. I mean, there are a lot of different ways that you can, even without words, still express emotions. It's amazing how much music therapists use sign language, which is used with, I mean, that's how deaf people communicate who can't hear. So how does music fit with that? But it's another way to communicate for people who cannot speak. So that might be a way. Like, can you use some sort of a gesture or a sign in order to communicate?
Or a drum or an instrument.
Yeah.
Yeah. Granted that they don't throw it across the room, because you want to minimize that that reaction, especially if they are acting out or behaviorally not acting appropriately. You want to minimize that chance.
I don't know if that answers the question.
I think you did a good job answering.
Okay.
I have another one. If an individual simply wants to learn how to play a specific music instrument, is this something that music therapy is able to do?
Yes.
In some ways, yes. In some ways, no. It depends. I think music therapy is not
a traditional music lesson.
Right. So learning how to play an instrument isn't necessarily a music therapy goal, but there are ways that you can address other things, maybe your self-esteem, maybe your fine motor skills, as you're learning to play an instrument.
Mm-hmm.
So I have people who are learning how to play guitar. I have people who are learning how to play piano, and through music, we're able to help them reach those goals. But the music therapy goal that I have for them is not that they learn how to play guitar. Maybe it's that they are able to increase their fine motor skills, or maybe that they're able to be responsible for themselves enough in order to bring back a record that they practice guitar or something of that sort.
And I think the important thing to point out here is that music therapy goals and objectives they're non-musical. But you can definitely, like Mica was saying, you could definitely have, to increase fine motor control. How are you going to do that? By playing the, doing a 5-finger piano pattern 5 times successfully or something like that. So in its traditional sense, music therapy is not used for teaching an instrument because of that. But you could definitely, I teach, there's some individuals I work that I teach, we've done ukulele and piano. They're learning those instruments, but the way that we have it in their plan is, is a non-musical goal. So we'll increase fine motor control, or we'll focus their attention. Their attention span is another big one. So
yeah, self-regulation is one. I have one who's just in 5 or 10 minute increments has learned a lot about music and piano. But his goal has not been that he learns about music or piano. It's that he's able to self-regulate, to be able to listen to and follow the directions that I give him in that little 5-minute lesson with however many prompts, and that's where the data comes in. Is he able to listen to me without me needing to redirect him more than twice? Or
yeah, that's a great question. That's a great question.
mm-hmm.
Someone else noted, great presentation. This is a beneficial service that individuals and families really appreciate and value.
Thank you for that comment.
Yes, thank you very much.
Someone else noted that your questions were answered well.
Great, thank you.
And that's all that I'm seeing. So if anyone else has any questions, make sure you type them in here.
Now would be the time, I guess.
Someone else said, thank you very much.
You are welcome very much.
Thank you for having us.
Yeah, we really appreciate you doing this for us. It was very interesting and beneficial information. For those of you that are Advocacy Links case managers, I will be sending out the link to the test for this. And for the rest of you, you should receive a confirmation email after attendance that you attended. And other than that, unless you guys have anything else to add, that concludes our presentation.
Well, thank you very much for the opportunity to present. We
Thank
appreciate
you
the opportunity
very much. You did a great job, and stay well.
Thank you.
Thank you. All of you too. Stay safe and healthy.
Thank you.
Thank you so much.
All right. Bye.
Bye.
Bye.